Hi friends. Hi. Let's go to some other questions. Okay. So, which of the following action by the nurse would certainly be considered negligence? The option number 1, inserting a 16 FR nasogastric tube and aspirating 15 ml of gastric contents. Second option is administering meperidine IM to a client prior to using incentive spirometer. Third option is turning and repositioning a client once every 8 hours post abdominal surgery. Fourth option is initially administering blood at 5 ml per minute for 15 minutes. Let's see which option is correct and why the other options are wrong. Okay, so the correct option here is option number 3, that is turning and repositioning a client every shift after post abdominal surgery. That is the correct option, but that is a wrong answer. In the scenario, the post operative client should be turned and repositioned every 2 hours after surgery to promote circulation and reduce the risk of skin breakdown, except if contraindicated, such as neurological or musculoskeletal surgery demanding immobilization. Okay, so the question said it's every 8 hours, so that was the wrong. So it has to be done every 2 hours if not contraindicated. Okay, the other options, let's say inserting 16 FR nasogastric tube. Correct procedure, verify placement by checking the pH. That is a correct option too. Then means correct approach. Then administering meperidine demerol IM to a client prior to using an incentive spirometer. What for it is given? Reducing the client's pain, enable the client to take a deep breath. So that is also a correct approach. But the question was what? Need a correction, and let's say. And the next one was the initially administering blood at 5 ml per minute for 15 minutes. So correct. This is a correct procedure. Start blood with the normal saline and a 19 gauge needle. Okay, that is correct. So 5 ml for the first 15 minutes blood transfusion, that is correct. Giving painkiller before the spirometry, incentive spirometry, and aspirating for the check and doing gastric aspiration and checking pH is all correct procedures. The position has to be done every 2 hourly. Okay, let's go to the next question. The question is, a day-old newborn diagnosed with intrauterine UGR, intrauterine growth retardation, is observed by the nurse to be restless, irritable, and fist sucking, and having a high-pitched shrill cry. Based on this data, which of the following actions should the nurse take first? So, an IUGR baby is irritable baby. Yeah. So let's see what the nurse has to do. So first option is massage the infant's back. Second option is tightly swaddle the infant in a flexed position. Third option is schedule feeding times every 3 to 4 hours. Fourth option is encourage eye contact with the infant during feeding. So let's see which option is correct and other options wrong. What are the reason? Okay, the massaging the infant's back, what you are going to do? You are going to overstimulating the child. So an IUGR with a shrill cry and irritable baby, big no for that. The second is tightly swaddle the infant in a flexed position. That is a correct approach. From what it does, it promote infant's comfort and security. So that is the correct action the nurse has to do. If you notice the baby irritable, crying, shrill cry, all those things are. And in the babies like that, babies, what you recommend? Schedule feeding times every 3 to 4 hours. No, not like that. So small frequent feedings are preferable, like maybe hourly to hourly feeding, but small and frequent feeding, not a long gap, not big feeding. Okay. And the fourth option, why it is wrong? Eye to eye contact, again it is going to hyperstimulate the baby. Overstimulation will cause, so that is not going to settle the baby down. Okay, let's go to the next question. School nurse notes that a first grade child is scratching her head almost constantly. It would be most important for the nurse to take which of the following action? So your class, in the class there is a child constantly scratching the scalp. Okay, first option is discuss the basic hygiene with the parents. Instruct the child not to sleep with her dog. Third is inform the parents that they must contact an exterminator. Fourth option is observe the scalp for small white specks. So when you observe something, what you have to do? First you should assess. So you should think in that way, like that. Something you observed, you can't make any decision or any judgment or assumption, anything, without you assess that child. I'm giving a clue, means like that questions how you have to approach. So here fourth option is the correct option. So observe the scalp for small white speck is the correct. Knit's egg, the lies egg. Knit's egg appears as small white oval flakes attached to hair shaft. So the child might be having lice in her, means in the knits on her scalp. That could be the reason the child is scratching continuously. So why it is wrong? First one, discuss basic hygiene with the parents. That is an assumption. Okay, must assess first. The second is instructing a child not to sleep with the dog. That also must assess to determine the problem. Okay, is the problem is the child is sleeping with the dog? No, could be some other. First you have to assess. The same thing, inform the parents that they must contact an exterminator. That's not enough information, because first what you have to do, make sure that it is required after your assessment. Okay, the next question. A suicidal client who was admitted to the psychiatric unit for treatment and observation a week ago suddenly appears cheerful and motivated. The nurse should be aware of which of the following: a psychiatric ward, a depressed patient. Okay, uh, observation. So now let's see. Suddenly the mood has changed. The it's happy and cheerful, all things of behavior is suddenly is happen. So let's see what we have to say. The client is likely sleeping well because of the medication. Second option, the client has made new friends and has a support group. Third, the client may have finalized a suicide plan. Fourth is the client is responding to treatment, is no longer depressed. So let's go and see the rationale. The option number 3 is the correct. Okay, the client may have finalized a suicide plan. As depressed clients improve, their risk for suicide is greater because they are able to mobilize more energy to plan and execute suicide. So a decision is made that going to suicide, then they will be more energetic and more excited. Okay, so it's an alarm, it's a red flag. Yeah. The first question the option number 1, the client is likely to sleeping well because of the medication. Improved sleep patterns would not explain the client's sudden mood change. So it's not the correct option. The same thing, friends and support group, support on nursing would not explain the mood change. Fourth one, the client is responding to treatment and is no longer depressed. Sudden cheerful and energetic mood does not indicate solution of depression. Okay. Next question. A nurse is caring for clients in the gynec clinic. The client reports an off-white vaginal discharge with a curd-like appearance. The nurse notes the discharge and valvular erythema. It would be most important for the nurse to ask which of the following questions. So, gynec clinic, you have a patient with a white vaginal discharge, a curd-like appearance. Okay, so and she noticed there is valvular erythema. So, what you have to ask the patient? First question is, do you douche? Second, are you sexually active? Third option, what kind of birth control do you use? Fourth is, have you taken any cough medication? So, from this, easily you can eliminate some of the. Do you think is there any relationship between cough medication and vaginal discharge? No, easily you can eliminate that. Then, do you douche? So the first option, do you douche, not a factor in the development of candidias. Okay, the fungal infection. That is, if the patient is doing douche, no, it is not a problem. When a sexually active, usually fungal infection, candidias are not transmitted by sexual activity. So predisposing factors like glycosuria, if diabetes, high blood sugar, then pregnancy and oral contraceptive pills, these things can contribute candida infections. So that is why. So you have to ask the patient, what kind of birth control do you use? Correct is oral contraceptive predisposes in individuals to candidiasis. That is the reason. So that is the question you have to ask the patient. The fourth one, why it is wrong? Have you taken any cough medication? That I already told you, there is no relationship between cough medication and the vaginal discharge. Then the nurse is caring for a client in the prenatal clinic. The nurse notes that um, the client's chart contains the following information: blood type AB, Rh negative, serology negative, indirect comb test negative, fetal paternity unknown. The nurse should anticipate taking which of the following actions. So the Rh negative, okay, mother. Administer ROGAM, means RH, D immune globulin program. Then second option, schedule an amniocentesis. Third option, obtain a direct Coombs test. Fourth option, assess maternal serum for alpha feta proteins. So let's see what you have to do here. The correct option is administer ROGA, immune globulin Rh negative for to an Rh negative patient. No indication of sensitization. ROGAM will prevent possibility that she will become sensitized given at 28 weeks of gestation if Coombs test is negative. So if Coombs test is negative and mother is unsensitized, because the blood bank will do means show how much antibodies are present. Then if she required, they'll recommend to need a ROGA. So ROGAM is required if the mother is unsensitized, because mother is negative and if she give birth to a Rh positive baby, then that is the time when anti-D or ROGAM is required. Then second one, schedule an amniocentesis. Amniotic fluid aspirated by needle through an abdomen and uterine wall to detect genetic disorder, not for any Rh negative. Then obtain a direct comb test, not from mother, it's from the infant or from the cord blood, okay? From newborns, not from. Then assess maternal serum for alpha feta protein level. Predict neural tubal defect. Does between 16 and 18 weeks. Okay, that is the test. Alpha feta proteins is done between 16 and 18 weeks to detect any neural tube defect. Let's see. The nurse is caring for a woman at 37 weeks gestation. The client was diagnosed with insulin dependent diabetes mellitus, IDDM, at at the age of 7. The client states, I am so thrilled that I will be breastfeeding my baby. Which of the following responses by the nurse is best? So the first option is you will probably need less insulin while you are breastfeeding. Second option, you will need to initially increase your insulin after the baby is born. Third option, you will be able to take an oral hypoglycemic instead of insulin after the baby is born. Fourth, you will probably require the same dose of insulin that you are now taking. Okay, let's go and see. The first option is the correct option. You will probably need less insulin while you are breastfeeding. Why it is correct? Breastfeeding has an diabetogenic effect. That is the reason the mother will need less insulin when she is breastfeeding. Less insulin is needed. The second option, you will need to initially increase your insulin after the baby is born. That is wrong. Insulin need will be decreased due to the anti-diabetogenic effect of breastfeeding and physiological changes during immediate postpartum period. And third option, why it is wrong? You'll be able to take oral hypoglycemic instead of insulin after the baby is born. Client has insulin dependence, so it is not going back to any oral hypoglycemic. That patient is going to take insulin throughout her life. Okay, so it's insulin required, IDDM. And the fourth one is you will probably require the same dose of insulin that you are now taking. During third trimester, insulin requirement increases due to increased insulin resistance. So this one is talking about postpartum period. Okay, so during the third trimester, what happened? Insulin requirement increased due to the increased insulin resistance takes place in an pregnant woman. Next one, the nurse is caring for client in a pediatric clinic. The mother of 14-year-old male privately tells the nurse that she is worried about her son because she unexpectedly walked into his room and discovered him masturbating. Which of the following response by the nurse would be the most appropriate? First option is tell your son he could go blind during doing that. Then second option is masturbation is a normal part of sexual development. Third option is he is really too young to be masturbating. Fourth is why don't you give him more privacy? So let's see what the nurse has to tell to this anxious mother. Okay, the correct option is second option is correct. Masturbation is a normal part of sexual development. True statement provides opportunity for sexual self-exploration. Okay, the why first is wrong. Tell your son that he could go blind. It's a wrong information. Then he is real. And the third option why is wrong. He is really too young to be masturbating. Boys typically begin masturbating in early adolescence. And the fourth option why wrong. Why don't you give him more privacy? It's a judgmental. Okay, doesn't take an advantage of opportunity to teach. So that's why that option was wrong. So thank you for watching. I'll come back with another video soon. Thank you.